Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Psychosis and the pharmacological treatment. So, the first step will be the first generation antipsychotics. So, there's first gen antipsychotics. So, under the first gen antipsychotics, they are generally not preferred due to the high risk of the extrapyramidal side effects as well as the tardive dyskinesia. So, it is not preferred due to the tardive dyskinesia as well as the EPS, extrapyramidal side effects. Next, we move on to the second generation. So here in second generation antipsychotics, the preferred drugs, it includes the risperidone. The risperidone, there is olanzapine. Next is there is quetiapine, and there is also the aripiprazole. Next is ziprasidone, as well as the paliperidone. So all these are involved. Next we move on to the benzodiazepines, that is a BZD. So here in benzodiazepines, it can be added to treat the associated agitation. So it is added to treat the associated agitation. And it is a drug of choice in case of catatonia. So it is a drug of choice in terms of the catatonia. Next, there are some special situations. So special situation, it includes the emergency. So emergency is a special situation. Under emergency, it is the use of short-acting intramuscular agents. So there is short-acting IM, intramuscular agents. So short-acting intramuscular agents, it includes the presence of haloperidol. So there is haloperidol. Next comes the flufenazine. So haloperidol, flufenazine. All these are short-acting IM agents. So haloperidol, flufenazine, then olanzapine, as well as the ziprasidone. Next, let's look at the chronic compliance. So under the chronic compliance, what do we have? So chronic compliance, it has a long-acting injectable is used. So there is long-acting of the injectables which is used. And what will be the treatment resistance? So treatment resistance will include 2 failed trials. So there will include 2 failed trials. So that is, we consider the clozapine. So what we consider is the clozapine. So all meds are ineffective. In such cases, we consider ECT. So there is no use of meds. So in this case, what we do is we consider the ECT. There is the cognitive therapy. To learn and grow daily like this, please do subscribe.